Have you noticed yourself forgetting things more often? Walking into rooms without remembering why or struggling to recall names? Most people brush these off as normal aging, but they might be warning signs of MCI, mild cognitive impairment, the critical stage where intervention can still change everything. MCI sits between normal aging and dementia. It's noticeable cognitive decline that doesn't significantly interfere with daily life. This is the window where action matters most. About 10 to 15% of MCI patients progress to dementia yearly. Within 5 years, roughly half transition to Alzheimer's. But here's the hope: MCI is potentially reversible. Risk factors accelerate progression. Physical inactivity reduces neuroplasticity. High blood pressure and diabetes damage brain blood flow. Depression impacts the hippocampus. Smoking and alcohol create oxidative stress. Social isolation removes cognitive stimulation. These are pathways we can interrupt. Normal aging involves forgetting parts of experiences, like names. MCI involves forgetting entire experiences, like meetings. Normal memory loss progresses slowly, MCI relatively quickly. With normal aging, you recognize forgetfulness. But with MCI, family often notices first. MCI is easily overlooked because symptoms are mild. This psychological barrier is why MCI often progresses untreated. But this stage is where intervention works best. Exercise is one of the most powerful MCI interventions. Recent neuroscience proves exercise directly transforms your brain through BDNF, brain-derived neurotrophic factor. BDNF promotes neuronal growth and enhances synaptic plasticity. Aerobic exercise dramatically increases BDNF in the hippocampus and prefrontal cortex. A landmark 2011 study had older adults with MCI walk 3 times weekly for 6 months. Hippocampal volume increased 2%, memory scores improved, and blood BDNF rose. This chain proves exercise changes brain structure, which improves cognition. Resistance training works differently. Contracting muscles release irisin, promoting hippocampal BDNF. A 2012 study had older women do resistance training twice weekly for 6 months. Executive function scores, measuring attention and judgment, significantly improved. Dual task training simultaneously engages movement and cognitive challenges. Walking while playing word games or stepping while doing arithmetic activates multiple brain regions. A 2017 meta-analysis found dual-task exercise clearly improved MCI, patients' attention, and executive function. Exercise also builds cognitive reserve, the brain's ability to maintain function despite damage. Research suggests 3 to 5 sessions, weekly 30 to 60 minutes each, combining aerobic with resistance training and cognitive activities, sustained for 6 months minimum. Cognitive stimulation plays an equally crucial role. Intellectually demanding activities stimulate language, memory, and creativity. Reading, playing instruments, chess, and handicrafts activate neural networks. A 2002 study found cognitively active older adults had 46% lower dementia risk over 10 years. Social interaction might be the most complex brain activity. Conversation requires attention, word retrieval, and understanding emotions. This engages the prefrontal cortex, temporal lobes, and limbic system. A Swedish study found socially connected. Older adults had over 60% lower dementia risk. For MCI individuals, having people to talk with stabilizes cognition and well-being. Sensory stimulation deeply influences cognition. Aromatherapy and music therapy stimulate the emotional brain. Gardening, cooking, and painting coordinate multiple senses with movement. Technology increasingly supports intervention. Cognitive training apps, VR environments, and online gaming provide engagement. A 2019 study showed digital intervention improved executive function in MCI patients. Lifestyle modifications complete the picture. The Mind diet emphasizes brain-protective nutrients, leafy vegetables, berries, fatty fish, nuts, olive oil, and whole grains. A 2015 study found strict adherence reduced dementia risk by 53%. Sleep is essential for memory consolidation and clearing brain waste. Chronic sleep deprivation correlates with MCI and Alzheimer's. Deep sleep maintains memory and attention. Stress management is critical. Chronic stress causes brain atrophy through inflammation and cortisol, suppressing BDNF. Managing stress through exercise. Mindfulness and nature exposure improves function. Social connection prevents isolation-driven atrophy. Social isolation is one of the largest modifiable dementia risk factors. Many facilities offer combined exercise and cognitive programs. Dual task sessions pair music-accompanied stepping with word games. Reminiscence therapy using old photos evokes memories while incorporating movement. Community-based care provides MCI support by integrating healthcare and prevention locally. Cognitive screening plus exercise classes and MCI cafes offer welcoming spaces. Emerging technology expands possibilities. Smartwatches track behavioral changes. Digital training adjusts difficulty using AI. Conversational robots prevent isolation. VR recreates experiences as virtual brain exercise. Future research trends toward personalization. Biomarker analysis enables progression prediction. AI analyzes lifestyle data for risk visualization. Gut microbiome connections attract growing attention. The fundamental message MCI is the moment you can still make a difference. Exercise increases BDNF and promotes neuroplasticity. Combining aerobic exercise, strength, training, and dual-task activities provides maximum benefit. Intellectual activities, social connection, and technology stimulate different pathways. Diet, sleep, and stress management form the foundation. Your daily choices about movement, connection, learning, and rest determine your cognitive future. MCI isn't inevitable decline. It's an opportunity to rebuild a stronger brain. The question isn't whether change is possible, it's whether you'll start today. Thanks for watching. Please hit that subscribe button and give us a thumbs up.